pretty much full time. I have a private office in Scottsdale. I'm at 1 day a week, and a lot of my workday and workflows focus on full arch implant surgery and restoration, the surgical and prosthetic portions of both. So we have a lot of courses at Pathway that are focused on full arch, not just full arch fixed, but overdentures and remote anchorage, etc. And we see a lot of patients all the way through their treatment cycle. That means we place the implants, whether it's a private surgery or a course, then we follow up with the patients in 2 weeks, maybe after they're done healing from the surgical phase and are transitioning to the prosthetic phase in 3 months. And the number one complication that I see, because working at Pathway and seeing all these cases at Pathway, we get to deal with the complications and fix them. Unfortunately and fortunately, has to do with soft tissue and how protected our implants are. If we don't have the soft tissue surrounding our multi-units, then or locator abutments or OD secures, etc., whatever abutments you use for your full arch prosthetics, then patients complain about sensitivity with brushing. That's when you have impaction of food, maybe a tartar buildup. That's when you start losing bone, possibly even starting peri-implantitis in those areas. Now, I am a general dentist and I do these surgeries, and I also handle the complications for them, because to place free gingival grafts around areas of deficient tissue for implant sites, not just full arch with what we want to focus the course on, but even single units, it's honestly, once you learn the workflow, pretty dang predictable. You don't necessarily have to be a periodontist like this guy, but I will let Dr. Rubinoff introduce his background and his soft tissue expertise and how that can add on to the equation.
Thank you.
Of course.
So my name is Alex Rubinoff. I am a periodontist. I was a general dentist for 5 years before deciding to go back to residency. Currently, I'm working at 2 different full arch centers. So much like Igor, I'd say about 30% of my cases nowadays are revisions. So patients went elsewhere, whether it's here in Arizona or maybe international, and then now have failing implants, recession, and need to have revision work. And I kind of think this should be in the toolkit of all dentists, surgeons that are doing full arch. Like, you need to be able to soft tissue graft your cases, whether it's before surgery, after surgery. It's going to save you a lot of headaches, a lot of complications down the line. And it's great that people are learning, how to do sinus augmentation to do full arch, and how to do remote anchorage to do full arch. But I don't think there's enough training and courses out there on how to graft soft tissue for full arch, and that's what we're hoping to bring to Pathway.
It's probably the only, like, the first one.
Yeah.
Honestly, I haven't seen any other courses offering this.
Yeah, and it's kind of like Igor was saying. There's nothing magic or difficult about this. It's just knowing what kind of graft, how to harvest, how to stay in the safe zone, how to prepare the bed, getting comfortable with suturing, especially with smaller sutures using 5.0, 6.0, and complications are pretty rare, especially with FGGs for full arch. Like, it's pretty. Infection rates are probably 2 to 5%, and that's really the only biggest complication. Maybe sutures coming loose, but that's something that only happens in the beginning, and once you get that down, you don't really deal with that complication anymore.
It's like adding a microsurgery approach to a macrosurgery environment.
Yeah, that's a great way to look at it, and
Yeah,
it
yeah.
will make you better.
Of course,
It'll make you better at everything in full arch, because once you're used to zooming in and suturing at that small level and paying attention to details, it will make your full arch surgeries better.
Mm-hmm. Well, we're gonna open this conversation up to some questions. Y'all can type it in the chat. We'll try to answer everyone the best we can. Can we see who's logged on? Or we're going to keep talking about full arch. Just making sure we're not missing the chats. Can't enable AI. Oh, there we go. Can you go over the outline of the course? What do we do each day? Well, yes, that's a very good question, actually.
Yeah. So day one, first half of the day is lecture, right? Different types of graphs, how to do each type. What are your, safety zones and safety margins, and you'll have a full protocol. Second half of that day is practicing on models. We need to get the suturing down, the harvest down. There's some techniques to learn there, and then day 2 and 3 is live surgeries. Right? And by the end of there's a ton of programs where in a perio program, you graduate after 3 years and you've done 10 or so grafts. And that's enough to be, as long as you have the didactics and you have the basics, that's enough to build on. Honestly, we're going to be giving as much clinical experience in this course as a lot of perio residencies in terms of the hands-on component and the surgeries done.
So 2 full days of live surgery, 1 day of didactics. And we're going to try to make these didactics very straight to the point, the things you need to know, not have a whole lot of filler in there. And the models we're using, we're going to have a pretty, top of the line model that you can see the differences in tissue layers. You can practice your nice and fancy suturing, so we can transfer that to the patient's mouth pretty easily in the next few days. And mentor-wise, you'll be working pretty much one-on-one with a mentor, and we'll evaluate the soft tissue environment that the patient has, what the best type of graft is, and what the best strategy is, and go from there. What if I want to learn soft tissue management, but I'm not doing full arch? Would this still be a good course for me to take? Well, the skills that you will gain from grafting a full arch of abutments can pretty easily be transferred to a single unit implant as well. So if you are doing single unit implants and restoring them, if you do have any soft tissue defects, doing these bigger grafts in multiple areas just gets your skills tuned in and gets you the reps. You can apply that to a smaller microsurgery area around a single unit. What do you think?
Yeah, definitely.
Yeah.
I think it's important for this class to have a pretty good surgical foundation. This is an advanced course. I think you need to be proficient in surgery, flaps, suturing, and so whether it's full arch or if you're doing single implants, like you were saying, and you want to do some free gingival grafts or CTGs around single implants, I think this would be a great course to take. Probably if you are not doing implants and a lot of surgery, a lot of this is going to be pretty difficult to catch onto. I'd recommend doing fast track or doing a fixed pathway courses first, getting the foundation, starting to do those cases, and then you'll really see the need for soft tissue grafting course. So this is much like a sinus lifting course. Like you don't learn surgery on a sinus lift course. This is a difficult course for you if you're not already doing some surgery. It doesn't have to be full arch, but have a pretty good proficiency in dental surgery.
You know the differences between single ties, mattress sutures, continuous, non-continuous, slings, etc. And then this will build on that knowledge base. We have a question from Dr. Nicholas. It says, will you cover how to decontaminate implants prior to grafting? And then Matt will get to your question right after this. So
So
tell us.
yeah,
Yeah.
so decontamination, for sure. We're going to cover that in the didactic portion of different methods of doing that, whether it's citric acid or laser or using a round burr to do some implantoplasty to make it a polished surface to graft. Another thing we'll be covering is how to close flaps in an attempt to avoid soft tissue grafting. So when to let flaps secondarily heal, granulate in, and get keratinized tissue versus when you should be getting primary closure. So there's an emphasis on avoiding grafting, especially in full arch, with proper closing techniques. But definitely everything from start to finish and treating implants with receding, with recession, treating implants that are failing and preventing failure on the soft tissue grafting side.
Nice. Then Dr. Clement said, sorry if I missed it. What are the dates for the course and how do we sign up? And just for fun, what is your favorite type of suture? Well, I'll go first. So I love Chromic 5.0. It's a workhorse, and I love single ties. That can get you through most things. There are fancier, more fun to do sutures, but I do think the surgeon's knot, a single tie, is the king of sutures, and it can bail you out of a lot of situations. I know Dr. Rubinoff here is going to say something along the lines of
6.0 Pro
6.0.
League.
Yeah.
6.0 Pro League.
Nice.
Yeah. Clean.
What about 3.0? Do you like 3.0?
No.
Yeah.
3.0 is unacceptable.
You're not going to find those in our ops. Nothing 3.0.
Yeah.
Pathway just responded January 14th through 16th, 2026 in Gilbert, Arizona. Really nice weather during that month.
Yeah.
And then we're getting messages from Pathway, and there's like 5 different accounts. But I guess we can see it. That's cool. But yeah, to sign up, message any one of us or Austin, Brittany, etc. They'll shoot you the details on how to do that. How many spots, doctors per course? Well, we want to keep it pretty minimal. So we want to keep the mentor to attendee ratio kind of
2
low.
at most, right?
2 attendees
3.
per mentor. And I believe for the first course, we're only really going to have 3 mentors. So I guess a total of 6 spots.
Yeah.
Yeah.
Yeah, you'll definitely have that one-on-one because this isn't a type of procedure that I know docs are doing and they want to get better at. This is like learn from scratch. I don't do this at all. And how do I get from not doing this at all to doing this comfortably on a daily basis in 3 days? And that takes a lot of one-on-one.
Yeah, for sure, for sure.
So yeah, definitely small numbers for this course.
All right, let's open up the floor for one more question because I actually made a very poor decision on making this webinar outside since these mosquitoes are coming out pretty hardcore. We just had a rainstorm in Arizona. So let's shoot what you got. We'll try to answer the best we can, but all we know is this course is going to be pretty fun. And you will be comfortable grafting your own cases with soft tissue, which not a lot of courses do. How many spots, doctors per course? Okay, we already answered that. Awesome. Well, it was a nice evening. Thanks for having us. And hopefully this is recorded so they can post it somewhere if anyone else has questions about possible sign-up spots or types of procedures. Level up your arch game. This is one way to do it. There's other ways, but soft tissue is king.
Yeah, must know. Must
know
for every
sure.
full arch surgeon.
Cool. Well, we'll see y'all soon, whether it's for other pathway events or the course. Keep in touch.